Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, we're going to be talking with Lachelle Jones. She's a high proficient ultrasound specialist with a focus on obstetrics, gynecology, fetal echocardiography. She holds the position of lead sonographer at Maternal Fetal Association in Reston, Virginia, with over 20 years experience in women's health and prenatal medicine. Lachelle has developed a comprehensive expertise in her field. Her journey in maternal fetal medicine was enriched by direct training from a perinatal specialist, which deepened her dedication to women's health, fetal development, and echocardiography. Commitment to excellence in diagnostic medical sonography. Lachelle actively engages in initiatives such as Intellios Diversity and Inclusion Task Force and mentors new graduates, emphasizing her commitment to advancing her field and enhancing patient care. Her proactive approach to professional development sets her apart as a distinguished figure in healthcare, serving as an inspiration to her peers. Recognized as the Institute of Advanced Medical Education lead OBGYN and fetal echo sonographer, she is enthusiastic about contributing educational resources for sonographers through various courses. Her volunteer work includes leading webinars on significant topics with ultrasound programs across the nation. Currently, she offers a webinar with BB Imaging, providing one continuing medical education credit on navigating through first trimester ultrasound. Lachelle's dedication to creating high quality education resources establishes her as a leader in the ultrasound community. Her work on PREPRY highlights her expertise and commitment to advancing knowledge in fetal echo exam, presenting over 170 questions and detailed explanation as invaluable tools for preparing for certification. This initiative marks the beginning of her mission to elevate medical awareness and education within the ultrasound sector. Please help me welcome Lachelle Jones. Please help me welcome Lachelle Jones. Thank you, Lachelle, again for joining us to talk about, I feel like, a really difficult conversation to have. We are going to attempt to talk about things that we wish our patients knew about ultrasounds in pregnant. I hope that patients who may hear us talking about this will maybe hear our heart and not any judgment from us, but maybe just to educate the public a little bit about ultrasound and what ultrasound techs responsibilities are, what we're required to do, and what we're, the time frames that we're needing to work with, so that when you come, you're a little bit more aware of the bigger picture of what our job is, what we're trying to accomplish for you. And we certainly, I have worked with a lot of colleagues that have certainly, no one is more passionate than an MFM sonographer. Let me just tell you that.
Absolutely. Say that again.
So thanks for joining me for this really hard conversation, Lachelle.
Thank you. Thank you for having me. I'm actually really excited. I know it's a hard topic to discuss, but I'm really excited to have this conversation because I feel like a lot of our patients aren't aware of the, I guess you can say, the inside scoop of, what we
Yeah.
have to deal with. And so I'm excited. I'm excited to have this conversation.
Well, good. Thank you.
Yeah.
I'm a little nervous, as you can tell. Oh. So there's several things that we wish that patients knew about our jobs. And
Mhm.
so we're going to try to cover as many as we can think of together.
Mhm.
And so we have a list of about 10 things. So I don't know. How do you want to do this? Do you want to take the first five and I take the second five or to talk about?
Yeah, sure. Absolutely.
All right, perfect. Go
I like
for
the
it.
first five. So the first five, starting with the first, of course, is how important is it for the patient to arrive early instead of late?
Yes.
This is why I can speak for my day I had today. Why I had the day that I had today was because we had patients arrive an hour late. And they, of course, still expect to be seen. And meanwhile, we still have patients that are scheduled on time. And so then you have to make a decision. Well, who do I see first? Oh, yeah, I know it's just a 10-minute scan, but the 45-minute scan was here on their appointment time. And it's not fair. At the end of the day, it's not fair for me to skip because someone was late. And so I must express that it is so important to arrive early, because that appointment time that you have or that the patient has is the time of us starting. It's not you just checking in. It's not you on the elevator. It's not I have to go to the bathroom and spend 5 minutes there. It's us starting the ultrasound. And so if we're starting 15 minutes within, it takes away from your time, your allotted time. And a lot of times we don't have a lot of time. We only get 15 minutes for one particular scan, or 30 minutes for a particular scan. And so if we're 20 minutes in, we're 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 defeating everything. We're not gonna we're already starting behind, in other words. And so it's really this one is the key one. This is number one and the key, as far as arriving early. And so the next one is no children. And we discussed this earlier at a different podcast show, but no children are allowed at my MFM practice. And this has been a rule since we had COVID. And so we didn't allow kids. And we saw that during that time frame, somehow our patients made a way where they did not have to bring their children. And so we were like, oh, so since they can find childcare and so forth, we just kept the rule. And I must admit, it's been great. It's been really great because a lot of times we have patients that come with children and they're by themselves, and baby wants to eat, and but I'm doing a fetal echo. And so
Right.
um oh, okay, let's stop, and feed the
So
baby.
yeah, I think it's important here to explain that at least my definition of high risk OB ultrasound is looking for millimeter structures that
Mhm.
occur in less than 1% of the population, right?
Wow.
So if that's what we're trying to do, right? I think it's interesting because I think the perception is that this is an entertainment.
Right.
And so then we have children running around the room and getting into stuff. And sometimes the person that comes with a child isn't as eager to keep the child out of trouble. Maybe they don't know
Mhm.
that that's what they're going to get into trouble,
Mhm.
or they bring the iPad. And so I'm listening to Disney,
Mhm.
you know, while I'm trying to
I
scan,
didn't think about
right?
that.
And I'm or the baby's crying, or the baby wants the mom, and the mom is
Mhm.
reaching for the baby to calm the baby down and looking there and kind of pulling away. And anytime the mom moves, affects our images, right?
Mhm.
Anytime the mom breathes, it affects the images, right?
Absolutely.
So if she didn't have that distraction, if she wasn't trying to calm her baby or entertain her baby or
Mhm.
explain something to her baby. Like, and then it's almost like they're disappointed because they didn't have their full attention to give to this baby. So then we're like,
Right.
oh, we're done. And they're like, wait, you're done? Wait a minute. I didn't get to see.
Mhm.
Well, but I don't, have time to show you
Enjoy.
now because you were busy. And the other thing I think the other point about children I think of is they don't take their children to work with them,
Mhm.
right?
Right.
This
Right.
is our work. And
Mhm.
it's challenging to
It
work with
is.
children in the room, right?
Yes.
It's a
Absolutely.
distraction on regardless of how good you think your child is, right?
Mhm.
And they're cute as a button, every last one of them, right?
Mhm.
But that's not the place for a child.
Right.
I
And
think I mentioned earlier there was a 9-year-old in the room when we had to give the mom some bad
right. It is, right?
news, right?
Mhm.
And maybe the mom wanted to process that a little differently for herself and then be able
Mhm.
to share that news with their son a different way. And,
Right.
and instead, that 9-year-old felt kind of traumatized, really. He was
Mhm.
like, what do you mean the baby's dead? What do you mean? What happened? How does this happen? Like
Mhm.
he himself at 9 had a ton of questions that really needed to be addressed, but maybe that
Right.
wasn't the time for her to address it with him, right?
Right. Mhm.
So allowing people in the room to support you in case you do get bad news,
Right.
right? So,
Mhm.
or that can be, and I think, there's always exceptions to the rules. I'm in a location now where I'm close to a military base, and we have young kids and families who have no family around them at all.
Mm.
So they don't have any resources for childcare, right?
Childcare. Mhm.
So I think maybe their husband's deployed or their wife's deployed or you know, something. Someone's not there to support them. And so I think there's always exceptions to the rules occasionally,
Mhm.
but if at all possible, it's not really a place for a child, right?
Right.
It's
I
hard for
agree.
us to concentrate. It's hard for us to ask you to leave the room with your child if they're being disruptive,
Right.
right? That's that's hard.
Mhm.
I know you
It
want to
is.
be there. I want you to be there, but it's hard to
It
say,
is.
sorry, but you know, you're gonna need to step out. I was in a location and did a GYN scan, and it was during the summertime, so all the kids were out of school. And the mom's like, I'm just gonna pop in here with my 6-year-old daughter and do this GYN ultrasound and get it done and out of the way. It'll just be fast, right?
Right.
You always get in trouble when you say, oh, it's just gonna be fast. There's nothing fast, you know,
Mm-mm.
there's nothing that should be fast, right?
Mhm.
And so, I said, well, she may have some questions and I'm not going to feel comfortable answering those, right? Because we're going to do a vaginal ultrasound. And she goes, oh, yeah, yeah, that's fine. So we keep her covered. And, the 6-year-old's up by the head of the table. And I'm in the middle of a vaginal ultrasound. And lo and behold, the little girl is like, oh my God, I pulled my tooth. I'm bleeding. I'm
Oh.
bleeding. And the
Oh.
6-year-old who was going to be totally fine
Mhm.
as far as behavior wise, pulled her tooth in the middle of a
Wow.
ultrasound, right? So now she's bleeding, and I'm trying to tell her where the Kleenex are. And so when she went to get the Kleenex, she noticed that I had a probe inside her mom. And then she had
Mm.
some questions, and she's like, what is going on here? Why does she have that in you? And so even when you think it's going to be quick and not a big
Mhm.
deal, it's not a place for a child. Like,
Right.
think about taking a child to a CT scan or an MRI scan, right? Like,
Right.
that's just,
It's not the place.
that's not the place.
Not the place.
So children, it's a big deal.
It's a big deal. And that goes hand in hand with the guest allowed with the patient. And so, with our rule is just one guest. which usually it's dead. So
Yeah.
that's all that's included with the ultrasound. And so and it works fine for us. You know, we do get a few complaints because of course mom-in-law or mom wants to come, and in
Right.
those cases they take turns. You know,
Right.
it won't be your only ultrasound, so then you could bring whomever the next time. And so
Right.
and it's been working fine, just far as to cut out the distractions that you need to
Right.
look at that millimeter structure that we were talking about earlier.
Right.
So
Right.
um, because, like you said, we're doing a job here. It's a diagnostic test.
Right.
It's a
Right.
diagnostic test, and so it's important to alleviate those distractions if we could.
Right. Absolutely.
I like how they're flowing. It flows in order with our list here, because
Yeah.
the next one was this is a diagnostic test. So
Yeah. I think this is huge. I think this is what shifts it from entertainment to a
mm,
medical procedure, really,
right.
on a lot of different ways. And so, like I
Mhm,
said, we're looking, at a 20-week scan, we're taking about 100 pictures, right? Roughly.
mhm,
Um, and each picture is taken very specifically and in certain planes
mhm.
and with certain settings on our machine. And if we see something abnormal, then as an ultrasound tech, our brains kind of start to go to put the puzzle together. Like, oh, okay,
Right.
so I need to go look at this then next, or I need to go
Mhm,
here, or I need to make sure of this. So, our brains are constantly thinking and moving, as opposed to at the same time, we're trying to entertain you or tell you what we're looking, right? So,
mhm, absolutely.
we're
And
kind of,
still being vague, because we can't say, we're not allowed to say.
right,
Um, it's hard when they ask us, "Is everything okay?" Because I can't say. You don't want to lie either, and so
right,
I always end up saying, "Well, the doctor will be in to go over." I
right,
probably say that 100 times a day. Deb.
right. Yeah, I agree. I think sometimes patients come in, they're so excited, right? And their emotions are like of excitement are like a 10, right? Super excited. And then maybe I see something and
You
I
get
know the doc,
quiet.
well, I don't, you know, get super quiet. I'm
Mhm.
still communicating what I'm trying to do and different things. But sometimes I do want them to be aware. So sometimes I will say there's some things that I'm a little concerned about, but I think I need the doctor to take another look at
Okay.
before we can really make a decision on what this is, if it is anything or not, right?
Mhm.
So maybe it would give them a little bit of a heads up that maybe there is something coming that's not
Mhm.
quite up to par,
Mhm.
so that when the doctor comes in, then you say whatever the news being
Right.
good, bad, or indifferent, right? Um, some locations I've been at, there is no doctor who comes in at all under any
Mhm.
circumstance. You come in, you get the test, you leave, and the doctor sends a report to your primary doctor, and your primary doctor will keep.
Mm.
So it's interesting
Mhm.
to see that kind of setup, maybe
Wow.
for
Yeah.
lack of a better word.
Mhm.
So there's a lot of different ways that different maternal fetal medicine labs kind of deal with those kind of issues.
Mhm.
Like you said, we're not allowed to tell if there's
Right.
so yeah, it's a big deal.
It's a big deal. It's a big deal. And it
Yeah,
goes with our next one on the list about the no cameras or recordings.
yeah.
Yeah, it
So
goes
why
right hand in hand with that because it's a diagnostic test. And so
it is a yes, it is a diagnostic test. You wouldn't do a recording of your
mm,
echocardiogram or your CT scan
no,
or
no.
any other exam. There are places that do 3D that are more than happy to give you more time for entertainment
Mhm.
and we support those places, right? Like go for
Yes.
all and bring all your family to those and have a great
Mhm.
time. But
Right.
purpose for coming to us. And most of the time, the camera and the recordings is a hospital rule. It's more of a global rule from the hospital in general, right?
Mm-hmm.
I've been to many, many orientations where they make it very clear to all modalities and all even nursing floors that no one's allowed to record nurses or administrating drugs or, you know, any of that kind of thing. There's just
Mm-hmm.
no recording or cameras allowed in any part of
Yeah.
the house.
And unfortunately, they're becoming clever. We had an incident where they had the glasses that record, and
Mm,
it just so happened the sonographer noticed a light, and that's when she noticed that, well, that admitted that he was recording. And not only is he recording a screen, but he's recording everyone he looks at. And, that's not, no one consented to that. She didn't feel comfortable
right,
because she was like, I didn't give you permission to record me and my voice and so
right.
forth. So you have to just be
And we do,
aware
right.
of that too.
And we do try to get some cute pictures for you to take
Oh,
home as tokens
absolutely.
of the memory of the
Mhm.
ultrasound. But again, there are separate places that do 3D, 4D that are there for entertainment, that give you more time for those kinds of
Right.
things. And the purpose of our exam is really just for
Yeah,
dice.
absolutely. And the 3D is the courtesy, which we say. It's just a courtesy.
It's a
Um,
courtesy, that's right.
like a sticker. So here's your 3D picture at the end.
Yeah. If the baby cooperates, right? There's
If
no
the baby
guarantee.
cooperates,
There's
absolutely,
no
that's a must.
guarantee.
There's no
Yeah.
guarantees. It's none whatsoever.
So the next few topics that we want to cover is there's a lot of questions that we get over the measurements.
Right.
So, you may say, "Oh, I'm 20 weeks and 3 days," or something,
Hmm.
just choosing something fictitious out of the air. And
Right.
they're like, "Oh, but when you measure the head, it was like 19 weeks and 3 days," and they get nervous and anxious. And um, it's not straightforward math, right? Like
Right.
A plus B does not equal C in the world of ultrasound measurements and equipment. So our
Mhm.
lovely equipment does all the hard math for us. At different times throughout your pregnancy, there are certain measurements that are more weighted
Mhm.
than at other time in the
Right.
so our faithful machines take all that in. It's already programmed into that. It's calculated. So that's why we call this an estimated fetal weight, right?
Exactly.
Uh,
That's the key word, estimated.
because even though our measurements are standard, we can take them 4 times and get a different number each
Different
time.
number each time.
The baby is moving, the baby's in a different position.
Mhm.
Um, if there's fluid or no fluid, extra fluid, too little fluid, there's a lot of factors that
Mhm.
play into the accuracy of our measurements,
Mhm.
the position of the baby. So it's not straightforward math. So if you
Right.
see perhaps 19 and 3 when you're really 20 and 2 or something, don't worry. Don't
Right.
get
Absolutely.
nervous. We will tell you an estimated fetal weight at the end of the exam when we're done with all of our.
And
So,
and a lot of times too, Deb, you have, and I'm sure you noticed where some it will say 20 weeks or 19 weeks, 3 days, but then it will say plus or minus 10 days. And so there's that
right,
discrepancy. And I do point that out for the patient. So then they're like, oh, okay, so it's still within, that
right,
discrepancy there. And that kind of reassure them, like, oh, because I get that question as well. Same
right.
there. Hmm.
Exactly. So in the
Hmm.
first trimester, a lot of times there's very strict regulations as far as our dating goes, right? Plus or minus
Hmm.
5 days, plus or minus
Right.
7 days, plus or minus 10 days, uh,
Mm-hmm.
plus or minus 10 days in the second trimester. And we're plus or minus 2 weeks on either side, and sometimes 3 weeks on either side of the due date we get in the third
Third
trimester.
trimester. Hmm.
So going back to the first trimester scan being so vital and important to get that
Right.
due date, because that's what's gonna, we're gonna compare all of our measurements back to that first trimester to tell if that baby's big or small.
Too
But if
small.
we keep moving that anchor, we can make this baby look abnormal in one
Absolutely.
way or the
Yeah,
other.
absolutely. Hmm.
So measurements are not a simple math.
Math. Right.
Right. So the next thing is questions versus education.
Hmm.
So I had a patient not too long ago. It was a father who came in and they were excited and different things. And he's like, okay, so explain the oxygen saturation from the
Oh.
placenta to the heart, the difference of the oxygen saturation that
Mhm.
occurs throughout from the placenta to the heart. And I'm like, you're kidding, right? Like,
And why do we need to know this?
right. And I appreciated the fact that he was intrigued enough about what was going on. However,
Hmm.
it's not our job to educate you on how this process works.
Hmm.
Google and different resources online can help you in any area that you are concerned about. But I,
It's not the
as
time.
sonographers, we do not have time to explain
Mm-mm.
how that works, why it works. We just don't. We do not have that time.
The time. Absolutely.
So I'm happy to point you to Dr. Google to help you
Mm-mm-mm-mm.
figure some of that out. But I'm happy to explain. I do a lot of explanation of like a biophysical profile and
Simple things,
what
right?
is
Hmm.
that and what does it entail, so you understand why
Hmm.
we're sitting there for so long and what we're looking for, right? Um,
Hmm.
but as far as
The fine
the
detail.
physiology and how things happen and occur,
No.
we
Mm-mm.
just don't have the time for that,
We
right?
don't. We do not. You know, I had someone ask me, they wanted me to recite the whole fetal heart circulation as I'm doing the fetal echo. And you know, when it causes you to lose focus on the task
Yes.
at hand. I'm trying meanwhile to measure the aortic valve and pulmonary valve, and your kid is doing somersaults in your belly, and now you want me to recite the fetal heart circulation. Like it's impossible, you know. And I did make a snarky remark, and I was just like, "Well, I have a YouTube video that explains it that you can
Very
freely.
good.
It's available
Yeah.
for the public." But unfortunately, I cannot explain it at the moment because I have the task at hand, and so
Right.
and she took it well. She took it well, but I just couldn't believe that, you know, the audacity. Just like what circulation? No, I'm sorry, I can't. You know.
Yeah, and as to speak to that a little bit is that looking at the heart is a whole new separate board exam that we have to take as sonographers,
Right.
right? So we take an OB exam and we have to take a physics exam in order to be able to take any other exam. So we
Right.
take a physics exam, we take an OB board exam, and then the fetal heart is an extra exam on top of that.
Right.
So, um, I often will tell patients I get really quiet when I'm looking at the heart because there's a lot of
Mhm.
pieces to the heart, a lot of moving things, and I just need my full attention when I'm looking at the
Right.
heart. I mean, it's just a lot to take in, you know,
Right.
to evaluate. So
Yes.
I think it's important to understand that because of technology, there's a lot more for us to look at.
Mhm.
And from the hospital's point of view, the hospital is a business.
Mhm.
And I know you guys hate to hear that probably, but they want as much production from us as they
Mm.
possibly can get from us. Like they will squeeze every second out of every day. And they have us on a time frame. Like you have
Mhm.
X amount of time to get this done. And if your baby's not cooperating, then guess what? We're running late. or you don't get a full exam.
Mhm.
So the hospital's like, move, 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 move. We want this all done in an X amount of time, right?
Right. Mhm.
And we're trying to keep patients satisfied and have good patient satisfaction scores as well
Mhm.
at some
Mhm.
locations. And so if you're late and for a 30-minute exam, and then I'm 10 minutes late for the next exam, right? And then that builds
You
throughout the,
never catch up.
and one young couple said, well, it was just 10 minutes. Is it that big of a deal? And I'm like, yeah, it is a big deal,
It
right?
actually is.
We don't know how your baby's going to act, and we don't know what position it's going to be in, but we are expected to get those images regard. And so
Right.
we have to struggle, we have to fight, we roll you on your sides, we sit you up, we lay you down, we send you to the bathroom, and we have to allow time for all of that.
Mhm.
Sometimes moms get sick and don't feel good
Oh,
when
yeah.
they're laying on their back,
Mhm.
so then we have to allow time to take care of that, right?
Mhm.
And all of these little things add up, right?
Right.
So if
Mhm.
you show up on your appointment time, you have to fill out papers, or you have to go to the bathroom, or whatever. You have to get
Mhm.
your child situated before you lay on the table. All these little things take a lot
Time.
away
Right.
from our exam, in which we have very little time for, right?
Right. Mhm.
So as far as the hospital is concerned, they want us to push people through as fast as we possibly can.
Right.
So I know that doesn't have anything to do with you and your exam, but it
Mhm.
does have something to do with the productivity of the sonographer, whether or not, we're not allowed to get overtime, so we can't go over, we have to get
Right.
this work done in X amount of time, is that
Mhm.
we really do want you to enjoy your exam. We
Right.
really
Mhm.
do want you to be able to take in the wonder of life that is going
Right.
on inside of
Mhm.
you.
Mhm.
So it is our purpose to help you to be able to celebrate that in whatever way you'd like. So please understand your sonographers do want to be happy for you, but
Mhm.
there's a lot of outside pressure on us to get things done, get them in, get them out, and get it done right. Get our
Right.
reports done right, get the images done right, and so just please keep in
It's
mind
a lot of
that
pressure.
we do want you to have a good time, but
Right.
again, this is a diagnostic exam and not an entertainment time for your baby.
Right. And a lot of times they really they I'm not sure what they expect, but they some are really bummed out that they don't understand or they don't see um clearly what they of their baby. Like they have trouble understanding. And so I try to say, "Hey, I went to school for this. I was trained for this."
Right,
And it takes time. This is not something that you will grasp. This is your very first ultrasound that you've ever seen. And so you're not expected to understand everything that I'm looking at. And I always make a point to say, just enjoy, just relax. And then I'll try at the end to get you some of those profile shots that you would understand, and just try to help put their mind at ease, because a lot of times they say, well, I don't understand what you see and things like that. And so I'm like, yeah, I went to school for this. I was
right,
trained. And so
right.
I try to point that out as well.
Yeah, it's interesting. The other day I had a patient who came in with her mother, a sweet,
Hmm.
cute young girl and her mom, and just a fun little mother-daughter bonding kind of thing.
Hmm.
Her husband was deployed, so
Hmm.
she was here and got some news at the doctor's office about something that they saw that was questionable, so she came here. And so I went to report to the doctor, and he was busy with another patient and dealing with another problem. And so I came back to my patient. I said, I'm sorry for the wait. The doctor's with another patient. with a baby that has a problem. And she goes,
Mhm.
"Oh my gosh, there's a baby that has a problem." And I'm like, "Yeah."
Mhm.
And
Yes.
she goes, "Oh, I hope things are okay." And I said, yeah, I hope so too, right? Because
Mhm.
I didn't know what it was.
Mhm.
But I had thought it was interesting, like no one thinks that there's problems,
Mhm.
right? And our whole day is dealing with problems, right?
Mhm.
And so I said, well, this is a high risk perinatal lab. So 90% of the patients who come through here probably have a baby that they have a concern about, or
Mhm.
a mom's condition that they have a
Mhm.
concern about, right?
Mhm.
And so it was really interesting to see her perspective of she was still of the mindset that uh, most pregnancies are fine, right?
Fine. Mhm.
And so I had to kind of explain to her that we're here to look for problems, and most of our moms that come in um, do have things that they're concerned about, like
Right. Mhm.
her child and granddaughter or
Mhm.
grandbaby, whatever it was. So yeah, that's
Mhm.
what we do. We
That's what we
we help
do.
and manage babies who have problems or moms who have problems that may cause problems to the baby, genetic, hypertension, diabetics. So that is our job, is to
Right.
help to manage and give surveillance to all these moms, right?
Right.
Um,
Absolutely.
and babies.
Mhm.
So that kind of brings up another thought that I had as well. Some
Mhm.
people will bring their babies, right? Their dad's holding
Mhm.
the baby's having a good time talking and screaming and whatever, but in the next room, we're telling someone else their baby died.
Oh.
So that's another reason why having children is a little challenging,
Mhm.
because we have anywhere from 4 to 5 rooms going per physician, and sometimes
Mhm.
we have two physicians, or some places even more than that, reading
Mhm.
ultrasound. And so I think it's important to understand that we have 4 or 5 rooms going, and although we may give you good news and you have your baby having a good old time, in the next room, there's a mom that isn't having a good time,
Good time.
right?
Right.
And hearing your baby coo and caw and have a good time or play or whatever
Mhm.
make her sadness even more, because she's not going to be able
Right.
to experience that, right? And
Mhm.
so it's not just about your ultrasound, it's about the diagnostic part of your ultrasound, and then everyone else in there too is there for reasons,
Mhm.
right?
Right.
That was just kind of an extra thing I thought of there for a second.
Yeah, but well, that's key because in the fertility realm of ultrasounds, kids, baby, they're not allowed in the building at all for the fertility. And so, and it's because of that very reason that you just said, because we have those that are unfortunately infertile or having trouble getting pregnant, or having recurrent pregnancy loss. And so to see a baby for some could be triggering. And so
Right.
they won't allow children at all, not in the waiting room, not nowhere in sight. And if they see a baby, they are asked to leave. And I've seen it, and it's because of that. You had just mentioned that, so just keep in mind, of all your surroundings as well, too.
Right.
Mhm.
Right.
Mhm.
So the last two topics are
Mhm.
basically, a lot of hospitals will send you a survey after your
Oh yeah.
exam.
Mhm.
And bad news travels fast. If we're wrong,
Mhm.
they will call us. They will
Mhm.
tell us. We always know when there's something wrong, or that we
Right.
say was wrong that was wrong, or vice versa, right? So
Mhm.
any kind of positive comment that you can leave goes so far for us. Like,
Mhm.
it makes us
Absolutely.
feel like, oh, right, we're doing something right, we're making an
Mhm.
impact, we're doing something that really kind of makes you guys happy and
Mhm.
contributes to your experience.
And it's motivating.
It
It's so
is
motivating.
motivating. And
Mhm.
like I said, we do want you to enjoy this, but
Mhm.
that's not why they're hiring us for entertainment.
Mhm.
They're hiring us
Right.
to find problems. And
Mhm.
so the other thing is that because we're looking for problems all the time, that can make our world very negative, right?
Mhm.
At times. And
Mhm.
so it's nice to have a nice
Positivity.
little pick me up of, oh,
Mhm.
this patient really enjoyed her time at her
Mhm.
ultrasound, or,
Absolutely.
she made us feel really comfortable, or something of that. And then
Absolutely.
our last topic is that your ultrasound techs are,
We are.
and we are so very human, right? And we
Mhm.
have bad days and we have good
Mhm.
days. And we have
Mhm.
families and we have sick kids and we have divorce and we have marriage and we have all the highs and lows that everybody else has. And although we put all that aside for your diagnostic exam and enjoyment, we're carrying loads ourselves personally, right?
Absolutely.
And we may not do everything right, but dang it, we are really putting forth an effort.
Yes.
And I just hope that you can hear our heart, that we love
Mhm.
our job.
Absolutely. I
There,
love my job. I
every
absolutely
we
do.
do. We feel very like we really contribute um,
Mhm.
to people's lives, and please keep that in mind. You know
Please keep it in mind.
that
And I was going to say that we too have miscarriages. We too had high risk pregnancies. I can speak for myself. I
right,
PROM'd at 30 weeks. I'm not afraid to say that. And so I too went through what you went through. And so we're not a lot of times I think they think we're like uh what is it, obsolete from having a high risk pregnancy or mishap to happen to us, but it has happened. And so I understand. I can speak for myself, especially that I do understand what you're going through in those settings. And so it hurtful sometimes when you say, oh, you don't understand, because I've had patients, say
right,
that to me, and I'm like, yeah, I do.
yeah,
I actually do. But yeah, so
yeah.
we are human, like you said. Mhm,
So, a couple more points I was just
mhm,
thinking of. One is for dads.
mhm,
Quite often, dads will get a phone call or they'll need to use the restroom or
mhm.
something like that. Um, we really try to protect the privacy of our patients.
Right.
And so we will send you to the bathroom and then we'll tell you what room to come back to. We cannot have people walking in the hall.
Mhm,
There's a lot of communication that goes on between genetic counselors and medical assistants and nurses and doctors to collaborate to getting best care for patients, whether it be you or someone else in the department.
mhm.
And so we cannot have you overhearing our conversations about
Right.
other patients. Um, and so it's important that, yeah, you can't walk your child around the department. You can't take your business call out in the hall of the department. Like
Mhm,
you need to go back to the waiting room or outside the department in order to take
mhm.
those calls or handle that situation, just so that we can take care of the privacy of all patients that are in the department. And the last
Absolutely.
thing is I'd like to just speak to anxiety.
Mm,
We understand that you're coming to maternal fetal medicine because they saw something or have a history of something. So we understand that your anxiety may already be high.
mhm,
But if you could be aware of your own anxiety as a patient and, talk about it with the sonographer. I had a patient
mhm,
just the other day she came in and she was just so anxious, right?
mm,
And she handled it so beautifully. She's like, I am
mhm,
so anxious. And I was able to say, oh, oh, I'm sorry. What are you the
Mhm.
most anxious about? You know?
Mhm.
And she told me her story. And I said, okay, on a scale of 1 to 10, where are you at with your anxiety right now? She said a 10. And I said,
Mm.
okay. And so I started to scan and I said, can you see the baby's heartbeat here? And she said, yes. I said, okay, now tell me where your anxiety level is. She goes, a 5. And I'm like,
Mm.
wow, okay, we're getting somewhere.
You're getting
And
somewhere. I
so,
like it.
yeah. And so, just walking her through the expectations of what the
Mhm.
ultrasound was going to entail and how it was going to be handled, and that she would get the results before she left and
Mhm.
different things like that. We talked about different things with her first pregnancy. And by the end of the pregnancy, I said, okay, so tell me before you leave, where's your anxiety? She goes, I don't have any more anxiety. I'm so happy,
Oh, that's
you
amazing.
know? And so we understand that you have anxiety. Another example that I had of a couple that came in that was super anxious. They came in and they're like, okay, so we need you to tell us everything that you're doing. We want an explanation of everything that you're taking a picture of and da da da. And I
Mhm.
thought, well, good morning. I'm Debbie. I'm going to be doing your ultrasound. Like I hadn't even had a chance to say hello, right? Before they were telling me how to do my job, right?
Wow.
And it just made it a little extra hard to kind of overcome that
Mhm.
with them because
Mhm.
I thought, man, you've kind of judged me before you even know me, right? Like
Right.
I
How do you
haven't
know
told,
I explain everything? I do
right.
usually.
I haven't even told
Mhm.
you that I explained everything yet. And you're telling
Mhm.
me what I need to explain, you know?
Mhm.
So just being aware that,
Right.
but allowing the sonographer to be the sonographer, and we're all different and we all handle the
Right.
situation differently, but know that you can advocate for yourself, and if you
Mhm.
don't get the information you want or need, that everyone is more than willing to help you to get that. So
Absolutely.
yeah, so just give us the benefit of the doubt a little bit
Give
to
us the benefit of
say
doubt.
we know a little bit about what we're doing, and
Mhm.
that we're really here for and in your best interest. And we're happy to work with you as a
Mhm.
to get you the results
Absolutely.
that you're like. But,
Absolutely.
presenting, there's two different ways to present your anxiety, right?
Mhm.
As I'm really anxious, almost
Mhm.
like, help me, almost is
Mhm.
kind of what I felt like. And the other couple is, I'm anxious, so you better do it this way. And
Right.
so as sonographers, you learn to adjust to all, but
Mhm.
you really get better results with honey.
Mhm. You do. I was gonna say we have thick skin as sonographers, but like you just said it, you get better with honey. Get a
Right,
lot of farther away for sure.
right. Any other thing that you can think of that you might want to share with our precious patients that come for ultrasound?
Oh, I love our precious patients. I did want to. I was one thing that did come to mind was about the transvaginal, trying to explain the transvaginal exams, and the most heard comment usually before I start to do a transvaginal scan is, "Oh, please be gentle." Or please go or just like I no one exert pain on purpose. I mean, they shouldn't. If they are, they shouldn't be in healthcare, but so I will go as gentle as possible. Yeah, that's the plan, but it's just I don't know, it's just that comment, usually I hear it's like, oh, please be gentle, and I'm like, I yes, I know. And so I that was just one thing I thought of when we were talking about. I too was a patient, so of course I'm going to treat you as
The
if I
way,
will want to be treated, and so
absolutely.
that keep that in mind, that's all.
Hmm.
So
Yeah. Yeah. And know that we have to push hard sometimes.
mhm. Yeah,
We're pushing hard so that our sound waves can get closest to the object that we're trying to visualize.
absolutely. Hmm.
And the deeper that object is, or the further away it is from our
Mhm.
camera that we have in our hand, the harder it is for us. So
Right.
understand that we're not here to inflict pain, like Lachelle
Mhm.
mentioned. But if it is uncomfortable, please let us know. Like,
Please
this is
let
our
us know.
personal space, and
Mhm.
nothing needs to hurt terribly
Mhm.
to get that. And so just letting us know, hey, can you hold up a minute on that pressure,
Mhm.
or something of that nature? We are definitely open to that. So
Right. Mhm.
we are your biggest advocates, patients.
Yes.
We want the best for you. We want to do the
We
best
do.
job for you.
Mhm.
Um, we love making happy memories for you and giving you information so that you can go make happy memories. But know that the gender is not our top number one priority, right?
Or the
We,
face. Or the face picture.
or the face pictures. That's right. We want to make sure there's a heartbeat, that the baby has healthy bones and
Mhm.
internal organs and is going to function outside of the womb. Or if the baby needs assistance after it's born, we want to make sure that we make good diagnoses, or give the
Mhm.
information to the doctor so they can make good diagnoses, so
Diagnosis.
that
Right.
if your baby does need a team of people when it's
We'll
we
be
will
prepared.
have all that prepared.
Mhm.
Today, my last patient, she was going to a larger city to stay up there because she
Mhm.
was going to deliver in a children's hospital where there would be a
Mhm.
team of people to help support her and her baby,
Mhm.
and the special needs of her baby.
Mm.
So, yeah. And
Mhm.
if we didn't do a good job, we would have never known that she was going to need to do so.
Right.
So we're happy to walk the journey through all these possible challenging times with you,
Mhm.
for you to have a good result.
Right.
So that's the end result, is for everyone to be able to go home healthy with a healthy baby as much as possible. And we love what we do. We love,
Yes, absolutely.
we
And we
love,
all share that same one common goal. Like you just said, that is the one common goal. Bring it home a healthy baby.
right.
So, yes, we all share that goal.
So thanks
Mhm.
again for sharing your thoughts
Thank
on these
you.
topics,
See, it
and
wasn't so bad, right?
kind of
So
having this hard conversation. I just didn't want it to come across negative, or that we
Right.
didn't care for our patients. We
Mhm.
really do. We have a lot of outside pressures on us from physicians to get good quality imaging, and
Mhm.
from hospitals to be productive, and without overtime. Right? But also to be able to meet the demands of our community, right?
Mhm.
With the
Right.
community having needs, we want to be able to get those people into our departments to meet their. So
Right.
um, we have to be efficient. And to do that, we need your help. And
Yes.
so having this conversation, um, I hope we'll do that.
Yes. Absolutely. It was a good conversation.
It was.
Uh,
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend, and remember to keep your frequency high.